Hey everybody, my name is Dr. Connor Bohr. I'm a board certified chiropractic neurologist in Phoenix, Arizona, and I am just so excited to be a part of this awesome foundation to bring both awareness and education about pediatric brain injuries. So here in our practice, we're seeing kids from all across the country and even all over the world with pediatric brain injuries, and we're able to see some pretty awesome results. It's my goal to help share some of these interventions that we're doing, to share some of these modalities that we're working with to help bring the best possible quality of life that we can to these kids who sustain brain injuries. What we do is something called functional neurology. Now, functional neurology works on the premise of something called neuroplasticity, which I'm sure a lot of you guys are familiar with. Neuroplasticity simply is the ability of the brain to change to help create new connections. Now, whenever I'm working with a kid, it's absolutely imperative to obviously have all the background, have the history, look at all the MRI findings. But what's equally important in our world is the neurologic examination. Now, from this examination, we're able to see all of the areas of the brain that are damaged, but also the areas of the brain that aren't really working the way that they should. So if I work with 10 kids with brain injuries, all 10 may the treatment plan may look a little bit different for every single kid because all of their neurologic examinations are going to be looking a little bit differently. Now, once we're able to find those weak connections and weak areas in the brain, we're able to deliver specific stimulus to those areas to help make them stronger and to help make them more efficient. Now, once we're able to deliver the stimulus into the body, and once we're able to make the brain start working a little bit more efficiently, we see a direct correlation with a change in symptomatology as well. Now, if we want to make the basal ganglia stronger, if we want to make the cerebellum stronger, if we want to make the frontal lobe stronger, it's obviously quite complicated. But to think about it in a simplistic sense, we're going to be doing specific therapeutic interventions and specific activations for those weak parts of the brain. Now you're probably wondering, what exactly does this look like? And again, it's going to look a little bit different for every kid that we work with, but we use all non-invasive, non-surgical, non-pharmaceutical interventions to help maximize neurologic efficiency. So essentially what our goal is to do is to help promote that normal, adaptive, physiologic state within the brain and the body. So we're going to use all of our senses, everything from touch, smell, sound, vibration, taste. We're going to use all of our motor systems as well. With a lot of these kiddos, we have to do more passive stimulation. So we'll do cerebellar activation. We're going to do vestibular input because all of these senses and all of these motor outputs are going to come from different parts of the brain. And our examination is going to help dictate which senses we have to activate, which motor outputs we have to help generate, whether it's eye movements, whether it's coordinated movement, etc. With a lot of these kids, we're going to have to work on primitive reflex integration. Primitive reflexes are the foundation of our nervous system, and it's something that we see a lot with these kids. So primitive reflexes can come about after a brain injury, but they can also come about by not being integrated from a developmental standpoint. Now, in 99% of kids I work with, we see these primitive reflexes reemerge, and it's absolutely imperative that we do activation properly to help integrate these primitive reflexes, because if we don't, the foundation of that nervous system isn't going to be built, which is going to be harder to help activate more of the cortical and cerebellar regions. We're going to be doing a lot of vestibular activation. The vestibular system, we know, is one of the biggest drivers of the brain developmentally. We're going to use low-level laser therapy. We'll touch on this a little bit more here in the next slide. Keep going on. We'll be using a lot of transcranial direct current stimulation. This is a way of hooking up different anodes and cathodes to different regions of our brain to help activate them from a electric standpoint. We'll be using a lot of PEMF therapy. This has seemed to work absolutely awesome with kids that are a little bit more high anxiety, more stuck in that fight or flight state, trouble sleeping. And something that's extremely important is something called functional medicine. So functional medicine works on the metabolic systems of the body, and this is going to incorporate both supplementation and dietary changes. And our goal with this is to help put the brain in the most advantageous metabolic state that we can, because we're going to be doing a lot of stimulation to the brain and the body, and we want to make sure that the brain is able to accept a lot of the stimulation. So it's important that we set the brain and the body in the healthiest state that we can to maximize all of the therapies that we do. So you'll hear Dr. Berry, my colleague, talk a little bit more about low-level laser therapy, but this is hands down one of the most important aspects of our practice. And we're able to use this piece of technology very dynamically to activate many different systems in our body. So if you look across here, you'll see us using it transcranially. This is one of the best possible things that we could do for the brain to help increase energy output with it. It helps increase metabolic mitochondria stores. It helps increase ATP. It decreases inflammation, and the list really goes on and on. This next picture here, you can see us using it right over the back. This kiddo is suffering from some tone issues, and we're able to use this very effectively to help modulate pain and really help change tone anywhere in the body. Here you can see us using it on the spine. And in the last picture here, you'll see us using it right over the stomach. This is going to activate something called the vagus nerve. With a lot of kids are going to suffer from GI issues, gastrointestinal issues, and we're able to passively use the laser right over the stomach to help activate that vagus nerve, which is going to create better talk from the gut to the brain, but also from the brain down to the gut, so we can increase peristalsis, which is food moving through the stomach, increase enzyme release, blood flow, etc. So this is something that we do with almost every one of our kids, because almost every kid that we work with has some sort of constipation issue, and this relieves the need to do suppositories, to do enemas, and help promote the healthiest gut that we can. So I want to talk about a little case study here to help bring some of this stuff to light. So this is a patient that I've been working with we're coming up on a year now. Her non-fatal drowning was in September of 2019. And as she was leaving the hospital, prognosis was very, very low. The doctors told the parents that there was going to be little to no quality of life. She was never going to talk. She was never going to be able to ambulate on her own. She was never going to have any quality of life, if you would. She left the hospital with 16 medications. And I started working with her probably around a year after her injury. And you can see her here on the right, and she is doing absolutely awesome. So she's starting to make all sorts of sounds. She's engaging with the environment around her. She's reaching and grabbing things with both hands. She was scheduled to have an eye surgery for strabismus, but with the work that we do, we were able to cancel that surgery because her eyes were tracking and aligned much better. And what's even awesome is she's even starting to crawl and move around. So we were able to absolutely blow past the prognosis of a lot of the doctors that gave this grim outcomes and outlook to the parents. And this is something that we're doing absolutely all the time. So using this integrative functional neurologic paradigm, we're able to co-manage with a lot of other practitioners as well. But we're able to see these awesome outcomes time and time again. And this is something that I want to scream from the mountaintops, because it's something that a lot of these kids can benefit from, but unfortunately not a lot of families know about. So this is something that I'm very passionate about. It's something that I'm very excited to share with you guys. And it's my goal to keep on progressing with education, with research, because at the end of the day, it's the most important thing to help these families. And with the integrative approach with the functional neurologic rehab combined with some of the other therapies that are out there, we really can make those dreams a reality with progressing forward with therapies. Thank you very much for your time, and I look forward to talking to anybody that's interested about this. I look forward to working with this foundation. If you want to reach me, you can email us at neuroactivelife@gmail.com. We're also very active on Instagram. If you want to follow us there, it's dr.connorbohr. And on that Instagram, you'll be able to see a lot of the success stories that we work with. And we'll be able to keep on educating the public about the novel things that we're doing. Thank you all so much for your time.